go through some presentation, share information with you. My original plan is that we will ask and answer questions at the very end, but if you've got a burning question as the slides go and as Shelley is talking, please use your raise hand feature and we will be sure to get those questions answered the best as we can. But as I mentioned, we've got Shelley here. I'm really gracious for her time, and I will be happy to turn it over to Shelley. Thank you.
Great, Kelly. Thank you so much for having me and commissioners. And I see a few of our human services staff members. It's really nice to see many of you and meet many of you. I'm Shelley Banker. I'm the director of the Office of Economic Security at the Colorado Department of Human Services. And within the office, we oversee things like all of our food and energy programs, which we'll be talking about today. TANF is also part of our group, and our child support services as well. And our team is also responsible for training all of the 5,000 plus eligibility workers that are processing all of the applications for Medicaid and SNAP and TANF, adult financial, all of the programs throughout the state. So we work very closely with your human services directors. And I'm also joined on the call today by Emily Hansen, who is our legislative liaison. Thanks for waving, Emily. So I'll be leading the majority of the conversation, but she's here today to support as well. So what I hoped we would do is just to start the conversation with a few slides that help to frame where we're at in Colorado, specifically with SNAP. And what I would want you to know is that yesterday we convened a group of food and hunger advocates and partners, our counties, and philanthropy to bring more information about what I'll be sharing with you today. And you may know that this conversation is really about, in November 2025, the U.S. Department of Agriculture, USDA, and Food Nutrition Services, FNS, sent us a letter saying that all of our SNAP benefits need to be put on hold. I'd be happy to share the direct language with you and give you access to that letter. But essentially what this means is that we will likely have many hungry neighbors throughout Colorado in November if the shutdown continues. And should the shutdown resolve itself before November, there are also some key points when clients are going to start receiving direct communications about their November benefits, and there may still be impacts to when they are able to get their funds or what funds they are receiving. There's a lot of unknowns right now and not enough clarity for me to be able to tell you with certainty what it will look like, even when the government reopens. The scope of this is we have about $120 million that are issued in each month throughout Colorado in SNAP benefits. And these then go on to electronic benefit cards, and we'll dive into the details here shortly. But what I wanted to do today was give you that information and then have a conversation with you to understand what else might be helpful in order for you to be equipped to talk with your constituents in the counties. So diving into the data, we have about 600,000, actually a little bit more, 600,000 Coloradans, and about half of them are children. We also see about 10% of our population falling within the elderly population and 15% with disabilities. We know that, again, there's about $120 million each month going out, and this is kind of just an overview of that. We can also make sure, Kelly and Katie, that you have the slide deck to share it after. Not surprisingly, you'll see that the majority of our benefits are distributed and complement the size of population within Colorado. So you see Denver and El Paso, the size of the SNAP recipients that they have in relation to other of our smaller and medium counties throughout Colorado. Just yesterday, we received a request. We had this information broken down by county, caseload by county, that we can share out. We also were asked to disaggregate that by zip code specifically. And so that's a new resource that we have as of yesterday that I can share out. When we look at spending trends, and I think this is really important too, especially if the shutdown were to last within just a couple of weeks of November, on average, we see about 80% of our households are spending their benefits within the first 2 weeks of the month. And then 95% of those funds are used entirely by the end of the month. Some folks choose that they might hold on to benefits. For example, as we're going into November, we might have seen that people were holding on to benefits and not spending them as we're going into some of the holiday seasons when people tend to have family gatherings around the Thanksgiving or our December holidays. And the first two bullets are from FNS, so that's a national number, but the snapshot that we have included here is our actual Colorado data. So you see that big spike in the first 2 weeks, almost consistently every month for the past these are the past 3 months. So what's the impact to clients? That's what we really want you to be able to understand and take away from the conversation today. On October 15th, so that was 2 days ago, our county started processing new applications that would receive their October benefit. And traditionally, this group would also receive a November benefit. If you're new, you get October plus you get the next month. We're not able to give those folks the November benefit right now because of the direction from the federal government. Then the next group of folks are those who are redeterminations, so they're reapplying and they're getting recertified, or they are just ongoing. The folks who for each month they're able to get their benefits. Those are typically delivered between the 1st and the 10th of the month, so November 1st and November 10th. And on the 22nd, they will start receiving their letters about those November benefits. So what this means, and the second part of this is kind of the place where you should be focused, I would think, is counties are going to should be expecting increased calls, and I think that they're already getting them. That's what we're hearing. Clint is on my screen, so he can probably shake his head yes, confirming that. There's going to be additional walk-ins. There are going to be clients who are frustrated because they are hungry and they need food for their families. They rely on these benefits. So having information on hand for our counties will be really critical. And yesterday we provided a full suite of client communications. And I know some of our partners had already started putting information on the website, but we hope to be able to equip with things like banners in English and Spanish for the TVs when folks walk in, and also social media posts, things like that. We have text message language already produced. We have emails. We are working within our Peak app, which is where clients go to apply, and all the messaging is ready and updated there. We also know that staff is going to need to spend additional time, and this is where, for county budgets in particular, we might see significant administrative costs and budgets. We would love to know if maybe mobilizing volunteers to be present. I don't know if that's helpful, but those are the kind of things that I would wonder if we might want to talk about today. And then our food banks and pantries, we know that they're going to see an increase. We convened them yesterday, and some of our county partners were there, and some of the county commissioners were on that call too. What we heard from them, I have another slide, but spoiler alert, it's money. Cash is needed in order to buy more food to have it on hand. So you might also be curious about what other states are doing. Just at a high level, we know that Massachusetts has convened a group called the Anti-Hunger Task Force. This, I think, is a more stand-up and formal group. We convened something like that yesterday, and we will probably continue to have conversations with that group. Utah advocates are also pushing for an extension in implementing HR 1. This is the federal act that was passed by Congress on July 4th. Those all take place and are effective on November 1, so we're also providing an additional level of complication for our county workers because all of the changes go into place. So Utah advocates in particular, because their governor is the head of National Governors Association, was doing some advocacy and pushing there. And then Minnesota, this is something that I hope we do not get to at all. But Minnesota made the choice to stop approving new applications. We're not having those conversations in Colorado, but I do want to let you know that some other states are taking and following suit, simply because they feel like the volume of the new applications is too much, and there's a lot of uncertainty about what happens with November benefits. As of right now, we're working with our county human services directors to say, continue processing applications and approving them so that when we have the funds, we can hopefully do a mass, in our Colorado benefits management system, we can do a mass push to approve all of them and get things rolling again. So this is what we heard yesterday from our food pantries. They're saying that we already have as many coming in a day as we typically would have seen in a week. So tons of volume increase. There's not enough food for people, and that sometimes means they take the allotment they can get at one food bank or food pantry and now are going to others to do the same because they are desperate for resources. They feel very supported by the community and volunteers. Didn't feel like that was an ask we needed to make right now, but we certainly know in media pushes that this next part is the thing that we want to be communicating. They asked for us to have a single call to action when we're talking to the media. And when people hear about this and want to help, some of the tendency is either to bring in canned donations and things like that to food banks, or for volunteering. What the food pantries and food banks need right now is purchasing power. They need money. They are able to buy at 20 to 30 cents on the dollar, which means that they can buy a lot more if they had cash in hand. So that will be the message that we want you to be able to share, but we will be putting into our media holding statements. And then this last part was just the additional data being broken down by zip code, which is what we were able to produce yesterday. And I'll make sure you all have your hands on it if it's helpful. So here's some of the key messaging. I don't know if this part's helpful for you, but the county human services directors all have this. And then I sent it out to CCI yesterday. I don't know if it's been distributed, but that whole communication kit that we have, we'll make sure if you don't have it that you do. These are some of the key messages, which essentially are just letting clients know, unfortunately, SNAP benefits are not available, but here are the best resources right now. We're really trying to push people to 211, which has a great resource finder, especially for our rural communities. And then Feeding Colorado has a food finder as well, helping to get connected to the food banks and food pantries. So I will stop there, and any questions you have, I will try to answer today to be helpful for the conversation. And if I don't have the answer, I'll make sure that we're able to get back to you.
Thank you so much, Shelley, and I really appreciate it. And we will get this slide in particular. We'll send everything out, but this one in particular with these key messages, we'll send that out here shortly. Who's got questions? Okay, let's see. I see something coming in the chat. I will go ahead. This is from Commissioner Lopez in Los Animas County. A letter from CCI to U.S. Colorado Senators Bennett and Hickenlooper asking them to sign the Clean Continued Resolution bill on behalf of Colorado's children. Congress can rehash. Commissioner Lopez, do you want to expand on any of that?
Yes, good morning, Kelly. And
good morning.
Yes, thank you all for having this roundtable. It's very imperative and important. Not any county, single county in Colorado has the sufficient funding to go through however long this shutdown is going to be. I think at this point in time, and I'm advocating for us to come together, I sent a letter to Senator Hickenlooper asking them to continue the resolution, the discussion on the appropriations at the federal level, of course, because in Colorado, real people are hurting. And throughout the United States, 3,069 counties, parishes, and boroughs are going to be the benefactors of the inaction of the Senate at the United States level. I know that this has become very partisan, but we have nonpartisan people on the ground here in Colorado that are suffering, that are going to be going into this whole thing. So I'm proposing to send a letter to the senators, and perhaps, I know this would have to be put to a vote, but this is not the time to continue to play politics with people's commodities, whatever they need. This is kind of a very humanitarian, real issue. And we are approaching the holidays, so there are so many complications. This is a moral thing, and I think they have the moral obligation to at least consider signing that clean CR that they have in front of them, and then they can go back and rehash any and all discrepancies that they may see with this whole thing. Our senators go to the United States Senate on behalf of all Coloradans, not just party lines. So that's my comment, Kelly. Thank you for giving us the opportunity to extrapolate. But I really believe that if all of us came together, certainly, the idea here is do it for Coloradans. If Las Animas County were to declare a state of emergency, I can tell you that we can probably last about a week with the reserves that we have. And at the end of the day, we may even end up getting, well, how come I didn't get any benefits, and they got them. So who knows what the ramification of this whole thing could be. But that's an opinion. Certainly, I want to thank you for all the work that you've done and the slides that you put together. Great work. Thank you.
Thank you, Commissioner. Lisana Munoz.
Can you guys hear me okay? Sorry,
Yep.
just a question on benefit delay potentially, right? Is there a time frame? I know like is it the 20th, 21st, if everything gets turned back on, everyone gets their accurate benefits, no disruption. Is there like a cutoff date in our system that they might end up having a delayed start to benefits even if we get turned back on post the 21st, or do we have any clarification on that as well?
Yeah, thank you. This might be a little bit technical, but there are several steps that it takes in order to get those clients their benefits out. So I think at the end of next week is when it gets a little bit tricky. If the government were to reopen and we also understood what funds were available, toward the end of the next week is probably when we would then still see those delays for the group of folks who receive their benefits from November 1 to November 10th. The reason for this is we have the benefits that need to come from the feds to Colorado. Then we send them to the vendor who puts them on the actual EBT cards, and they can only batch a certain amount each night. So it's all a lot of moving parts, and we would certainly be calling in as many favors as we can. And other states will also be in this situation who rely on the same 2 or 3 vendors who put the money on the cards. But I know that we will be doing as much as we can, and our team's working night and day once we get those funds back on.
Thank you. I appreciate that.
Thank you. Commissioner Warren Gully.
Shelley, thank you so much for all of your work on this. I know I've been on several calls where you guys are just scrambling and pulling together great folks to figure this out, and particularly our food bank partners. So thank you for all of that. I had 2 questions. One was the request by the food banks to get the zip codes. Is that just so that we're able to see where the biggest concentration of need is? Is that what their request was about?
Yes, Commissioner.
Okay, thank you. And secondly, you already kind of hit on this a little bit, but I'm just wondering how this HR 1, which was going to land on November 1st with our CBMS system, and this interact with each other. I appreciate that Utah is saying maybe we postpone HR 1 for 1 more month until we get this figured out. But how is the state feeling that our CBMS system is going to be ready for the new requirements as well as this potential shutdown continuation? Does that make sense?
It does. Thank you, Commissioner Warren Goley, for the question. So I will lift up just a little to make sure I give the context. On November 1 is when all of the changes from HR 1 are required for states and counties to start. So we had changes to folks who are ABODs, or adults without dependents. So the work requirements changing there. We had changes in energy programs and then immigrant populations. We've received guidance on 2 of those, so 2 of 3. So the third one, the feds are expecting us to begin with those changes, though they haven't given us the guidance, which is a bit unprecedented and then complicated because the government is shut down and there isn't anyone there to give us that last set of guidance. For the first 2, we are working with Deloitte, and we do have the builds that will turn on November 1st for that. So there won't be complications necessarily. That's a separate work stream, fortunately. So Deloitte is able to do that, except that on November 1, if we don't have benefits and the government is shut down, we won't be processing those cases. Those cases won't be complete. We are processing the cases, but the cases will not go through the final step to get benefits out the door. The other complicating factor I would want you all to know about is that we're not sure how this would impact our payment error rate, which is another component of HR 1 and is the lever that determines how much the state will be responsible for state share of grocery benefits in the coming years. So this could potentially produce errors, and we are not sure what that will look like. What Utah is trying to do is that they're advocating to the federal government for the federal government to say, we understand that there are complications in implementing HR 1 on November 1st as instructed, and that can't be done because of what's happening with the government shutdown. So they haven't made the decision to delay, they're just advocating to delay, and I don't know if they will be successful. If they're successful, then I imagine it would be a blanket for all of the states. I would hope that it's all kind of unknown right now.
Yes.
Did I answer your questions?
You did, Shelley.
Okay.
Thank you very much. And it's very complicated, but I appreciate that. And, you know, obviously all of us on the call here, as Commissioner Lopez says, really want to help in any way that we can to advocate or do whatever's needed.
Mm-hmm. Yeah.
Thank you. Commissioner Aiken.
Yeah, when we were at our budget meeting, we talked about funding through the county, and our accountant said that there's a possibility that down the road the government would say that, well, we don't need money for SNAP if we can fund it ourselves, and that there's a possibility that they would not continue, thinking that the counties we were okay to fund it ourselves. And I don't know if there's any clarification on that, or she mentioned something that happened in the past where some of the benefits were taken away because they decided the county had enough money to do this themselves. So I'm just wondering if the county puts in money into, cards or something, whether that will come back on us.
I don't know what has happened in the past, so I can't speak to that part. I think that the scope and amount for completely covering these benefits is quite significant. It's $120 million approximately for the entire state. Each county, of course, is different. So I haven't had heard anything about that yet, but we would be able to equip you to understand, what that would look like. I don't think that we have a mechanism for counties then to help us get them on the direct EBT cards or to stand that up that quickly. The other thing that I have heard, and I don't want to turn this and, scare anyone, but APHSA shared a bulletin earlier this week, and there are American Public Human Services Association, and they indicated that there is an option, and to be clear, FNS, Food and Nutrition Services for the feds, has not said anything about exercising this or plans to, as far as I am aware. But the APHSA flagged that there's a retailer option that FNS could exercise, which could say that even if folks have money on their EBT cards, it would direct retailers to stop taking or accepting EBT benefits. So in cases where the state or counties were to put money on cards or individuals had cards, if this were exercised, again, it is not something that I have heard that they are going to, just an option. That would mean that folks would go in and would not be able to use any EBT benefits that are on their cards. And I only say that if you're considering it and if we had the mechanism to put money on cards, that's just another complicating factor that could potentially be out there.
Thank you. Commissioner Smith.
Shelley, thank you so much. I have a meeting with our food pantry director directly following this meeting, but given the stress that you've already identified food pantries are experiencing around the state, I'm anticipating there could be a lot of logistical considerations when it comes to like what are you hearing that pantries need from counties or community partners when it comes to, I'm just thinking about like the volume of food, the volume of people, how to logistically organize some of this. What have you been hearing, and are there any state resources for that type of deployment? I'm also thinking about at the county level and community partners, what we might be able to offer in terms of some of those things. But yeah, just curious if you've heard any feedback from pantries directly.
Yes, yesterday the food banks and food pantries, they agreed the collective call to action is really that financial component. And the reason for it, because we know that community members will want to, again, help by bringing in those donated items. We want to help to get the communication out that we love community support and we do want people to be able to help, but food banks and pantries have incredible purchasing power. So giving them cash helps an individual donation to go 2 to 3 times further. So that is the big message that I heard from the food banks and food pantries yesterday. Circumstances could be different in every community, but broadly, it felt like they were okay on volunteer capacity or also the distribution capacity, but it was more about getting money to be able to buy the commodities to have on hand. And so if they knew that they were going to be refilled, they could quickly push out more of their current inventory with others coming in, but they need money quickly in order to do that. At the state, I think everyone is aware that we are in a budget deficit, so that makes things particularly tricky. And I think that answers one of the questions in the chat too of, are there state resources? And right now there are not state resources.
I feel like the manners say thank you, but what a bummer. Commissioner Marlin.
Yes, thank you. I used to manage a grocery store, and it occurs to me that if people stop using SNAP to buy food in grocery stores, that food is likely to expire. I wonder, are there conversations happening at the state level with the major grocery chains about any role they may have in a solution to doing something other than watching food expire?
Thank you for the question. So first, I do want to make sure that we're still letting people know that as of right now, the money that's on their cards, they are able to use. That option that I mentioned is not something that's being exercised. However, I do realize that grocery stores have probably bought with the idea that $120 million next month is going to be able to come to them. I think that's the next important conversation for us to be having with the food and helping to facilitate at the state with our food banks and food pantries and the retailers. That wasn't something that they weren't part of the conversation yesterday, but I know at the governor's office, we've been talking about how to get them involved. Thank you for the question and thanks for everything you're doing.
Commissioner James.
Thanks, Kelly, and thanks, Shelley, for the presentation. I'm wanted to interact with a couple of the other questions that have been asked, but I was driving. And how the hell do you find the hand raise on the mobile app? So I'm back to the house now. Here's my questions. Talk to me about the actual mechanics of how an EBT card. What is the fungibility of the money? Say if the county, and I don't know whether my fellow commissioners are on this call, but say if we wanted to try to backfill that, would we be backfilled by the federal government? Could we float to the federal government, so to speak? And then how does it actually work? You spoke a minute ago about maybe EBT cards being shut off. Where does the money come from? Where does it live? If we had the desire, how can we make that work?
Great question. Thank you, Commissioner James. And I'm sorry that you were having trouble talking while you were driving. I'm sure that was hard for you to not be able to say you wanted to talk. But I hope that's okay.
I like to talk. You know
yes,
that.
We interact quite often, so we have to keep it light when we can. So the question is, how mechanically could we make it happen? And we have looked into that. We've said, okay, what would it look like if we had the funds? And I think that it is a lot of logistics, but it's possible. And Clint probably knows this really well. It would, I think we estimated that it would be at least a week's worth of work because we're moving from one area. Typically, the money comes from the federal government to CDHS. CDHS is then taking that money, and there's lots and tons of steps in between, and then lots here to actually deliver it to FIS, Fidelity Information Systems, who is our EBT vendor. And then they're the ones that distribute it based on what Deloitte says the individual should get. The complicating factor that you asked about is kind of the unknowns of, will the federal government backfill? In 2018, 2019 shutdown, we were in a much different position where there were appropriations for those funds, and the federal government was working with states to deliver funds early. So I think it was in January, we were calling people and saying, you're going to get this money early. And everybody was all hands on deck and getting the money out the door because we did have it. The big wild card here and uncertainty is, even if we had the money to pull from other places, would the feds backfill it? And right now there are not any indications or certainty. And we've done some legal analysis on that too. And we're not feeling confident that, should they come from the county coffers, would they come from the state coffers if we even had the state coffers? Because again, this is hundreds of millions of dollars. Would it be backfilled?
It is a funny thought to think about flooding the federal government. It is an abhorrent thought to be able to think about not being backfilled. And so you have answered my intention. Thank you.
Yeah, thank you.
Commissioner Hollingsworth.
Thank you, Shelley and Emily, for having this. I was on the version of it yesterday and talked about challenges that we have as a small mountain community. So my question is about logistics, about what the planning is to get food to the pantries that are in the mountain communities. Right now, we have a once a month delivery from Food Bank of the Rockies, which is very appreciated, but it is once a month. It's a large amount. So every other week, if there's food available from Food Bank of the Rockies, that requires a staff person or a volunteer to drive down to Denver to get whatever they can fit in their truck and bring it up. So it's not very efficient, but again, appreciated. So the money is great. It's just how is money gonna translate into actual food on the tables at the pantry for these more isolated locations that aren't down in the metro area?
Thank you. I got the impression yesterday from the food banks and food pantries that they are willing to employ all kinds of different logistical solutions in order to get food where it needs to go when we have it. So I know that it is a challenge, especially like if we have a blizzard in Colorado. Wow, wouldn't that like just add to the situation we are having? But we know that the food partners and pantry folks were very willing to look at other mechanisms. And I think that in this case, it would definitely be more than a once per month situation. And personally at CDHS, we also do the national school lunch distribution. So we have 2 trucks. So I could even say to my team, we need to get a delivery out to some of our rural areas to make sure that food gets to people when they need it. But thank you for bringing that up because we want to make sure we're aware of all blind spots and can have solutions for them.
Thank you. Tammy, and I'm sorry for the informality, but I know your last name is not iPhone.
It is not. Sorry, I'm driving, so I can only put in my first
No
name.
worries.
Shelley, this is Tammy. I just have a quick question. To your point earlier where you were saying that about 85%, I think is what you said, spend their allotment within the first 2 weeks. Is there a way that counties can get either a zero balance report or that report specifically so that we can see the potential of folks that are in our county that have nothing on their EBT card so that we can have more informed conversations with our local food networks?
Yeah, absolutely. I know that we have run some reports in the past to understand the balances, especially when we were looking at some of the when stolen benefits were happening, and we wanted to know the scope on the high end of what balances were being held as they were most vulnerable to being targeted. So I know we have the mechanism to also then look at who has almost nothing or nothing on their EBT cards and would not have anything to help hold them over. So I will get that report. I'll see how quickly we can get it, hopefully by Monday, and be able to share it out on the county director listserv.
Thank you, Shelley. As we wait to see if we've got some other questions, I have a question. Is there a best place or a clearinghouse for financial donations that we can give personally or that we might be able to direct our community to give? Or how can we help in that regard?
Yeah, absolutely. Thank you for the question. Yesterday, when we were talking with the food banks and food pantries, Feeding Colorado said that they have a mechanism to have individuals select by food area. So someone living in a community could be sure that their donation was being designated. That is something that I can make sure we share out today, but will absolutely be in the media communications that we're putting together. Again, cash is king here. If we can get cash in the hands of the food banks and food pantries, they're able to buy more. So when we're then making that ask, we want to be able to be sure that people can easily do it. That clearinghouse, Feeding Colorado, they agreed that they would be the place to do it.
That's great. Thank you very much for that. Any other questions? Clint, I saw you had your hand up earlier. I don't know if yours was answered or if there's something you'd like to add. Sorry to put you on the spot.
That's okay. No, I was just going to comment on Commissioner James' question. In the past, 15 years or whatever, whenever we were in this situation, FNS or whomever would whatever federal group we were talking about would be very clear as to whether they were going, if they intended to backfill us or float us. If we paid, they were very clear and upfront with us on that. And the fact that they haven't been this particular year would lead me to believe that we probably won't get backfilled. But I'm no expert. It's just completely different of all the other scenarios that we've encountered in the past.
Thank you.
Kelly, I know I didn't raise my hand, but it's Carrie Warren Gully. Shelley, so I appreciated you kind of giving us a feel for timeline here, but basically drop dead date is the end of next week. If there's no resolution to solve this, then we're in trouble for November 1st. Am I understanding that correct?
Yes,
Okay. Thank you.
unfortunately.
Commissioner Smith.
Yeah, thank you. And I did ask a question yesterday about the Feeding Colorado. And so in the donation proposal that is being established. And so, and I don't know if I received an answer or if I'm just not understanding something very simple, because I think that there's a distinction between, well, let me just back up. When I put in my community zip code in the Feeding Colorado website, it says no matching results and to expand my area search. And so I believe that's just identifying perhaps particular locations associated with that organization to acquire food. But is there going to be a further disaggregation when it comes to the donation portion of that? Can you help me understand how that is supposed to look? Or I just didn't know if there was a totally separate methodology based on what I'm seeing for rural communities like mine, we're not accounted for in their website. And so I'm just really curious about that piece. Thanks.
If you'll give me a second, I'll be able to answer the first, and I just want to send a text to Mandy Nuku at Feeding Colorado and ask if she can help me with the second part. So if you don't mind, just give me one moment.
Thank you, Shelley. Nothing like a phone a friend.
Okay, so I've got the question out of specific donations. How would we make sure that Feeding Colorado can designate that out if the food pantry isn't part of their network? Commissioner Smith, to address the other part of your question, intentionally in the resources that we are sending out to clients for where to find something in your community, we put 211 first in all of those communications, because we think both are really good resources for big portions of the state, but there are some gaps in the Feeding Colorado Find Food in my location. And we did some testing on our sides, but I'd love to hear if it didn't meet the needs for your community. And we found that 211 had the most comprehensive list to be able to help identify those. So we intentionally put them on the first bullet and then Feeding Colorado on the second bullet. Manny Nuku says we can determine that with our food bank partners where there are gaps and use the data of SNAP recipients by zip code. So I think what she's saying is that we're going to figure it out, but I will make sure that we follow up and we're able to say exactly how that's going to work. But I think what I'm hearing here is that she's willing to make sure that we're identifying those gaps and we get the donations to the right place.
Thank you. Commissioner Lopez.
Thank you, Kelly. Shelley, I want you to read the comment that came out from Executive Director from Los Animas County, Mr. Michael Aragon, that some of the local vendors are indicating that they're not going to be accepting EBT at this time due to the uncertainty of reimbursements. So I think if that's already happening, that creates another algorithm that is we're going to have to be addressing at the local level. But my whole comment was going to be a question for you. What is Governor Polis's reaction to this whole thing? I mean, once again, I'm going to go back to the same perspective. I think we need to urge him to reach out to both U.S. senators and encourage them to support this. And they can go back once again. They'll have the time to go through the regular budget, line item by line item. They can get in the big arguments that they know how to do. But certainly at this point in time, I think the governor can have a big leverage with our U.S. senators. So that would be something that through CCI, I would encourage that conversation as well to move forward. But that comment that came from our executive director, it's a bit, it kind of gives me a pause on the whole thing, but thank you.
Thank you for bringing my attention there. Michael and I were chatting yesterday at the end of the day about this, except we were talking about that right that FNS has to exercise the option that they can exercise, but not about this part that some retailers are already responding to that. So that is new information to me, and I'm really glad that we're having this conversation so that it's been flagged, and I can start to think about how our media and comms can help to accommodate that. What's tricky is that we don't know if FNS might exercise this option and might say that retailers should not or cannot accept EBT. What I do know is right now that FNS has not said that, and so I'm wondering if there's some speculation here. There's like one person still working at FNS right now, so I can have our team reach out today to say, you know, do we have any information on this? Is this a possibility? Could there be some messaging from FNS to retailers about it?
Shelley, this is Michael. I hate to jump in, but
No, thank
these
you.
are smaller vendors within the community. So it's not like Walmart, it's not Safeway, but these are smaller vendors that accept EBT. And our messaging has been aligned with what your messaging from the state was yesterday. And so my concern is that we're starting to see this with signs on doors indicating to clients walking through that they are not accepting these EBT benefits at this time. So I think there is speculation, but it's starting to impact these small vendors. And I think we're going to see it widespread. And I see that Linnea put in there as well as in your Ray, same thing. So I just wanted to flag that for you because I think that's definitely going to have an impact if we don't get in front of that.
Okay. I'm going to have the team reach out to FNS right now in order to see what they're hearing. Unfortunately, sometimes it's like it's the person lowest on the totem pole who is in the office right now. But I'll do what I can on that front, and really important flag. Give me a few hours to figure out what from our position, what we can do beyond working with FNS. But wow, that's not great for folks who have the money and who need the food, or for those retailers who have food on hand and now are fearful that they wouldn't be able to get reimbursed.
Commissioner Porter Norton.
Yes, hi everyone. Having just gone through this with the flooding, I asked this in a very serious way, but have we thought of any levers? Should this go on, let's say, for a month, 6 weeks, goodness forbid, for 2 months or something like that? Is there a declaration, like a disaster, that could open up different lines of ideas for problem solving? And I'm thinking of Commissioner Marlin's idea of, you know, grocery stores that are getting rid of food that's expired and stuff like that. I don't know if we're there yet, but just something that we may need to be having to respond in a different way than only relying on food banks or foundations. Thank you.
Thank you, Commissioner. I don't know, Shelley, do you want to respond to that?
I would love to hear from this group what that might look like and how we could be helpful. That having more of those conversations, whether it's here right now or another convening, which I know Director Barnes would be happy to do in the next few days, to just brainstorm and figure out what else that would look like and how we can use the reach that we have at the state in order to help with that.
Commissioner Mitchell.
Thank you, Kelly. Possibly the state could indemnify grocery stores for any food that they do donate to local food banks in their region to try to keep it close and tight. And with that indemnification, they wouldn't worry about giving out bananas that are a little bit on the brown side, but still completely edible. And that might help prompt grocery stores to not throw away leftovers. They could make them available for anyone who was needing it. So that's just a thought. Thanks.
I like it. I like the good solution thinking. Thank you, Commissioner.
Great, thanks.
And then I just want to point out in the chat from Yuma County, they say, I appreciate the use of 211 or Feed Colorado, but neither of these online resources meet the needs in rural Colorado. We have to pull out all the resources we can, which adds some additional barriers. So I do think that's right. And then if you look earlier, it does talk about maybe it would make sense in rural communities to donate directly to those food banks and pantries, and just wanted to kind of raise both of those for you, Shelley.
Thank you. I appreciate that. I was responding to the first, and Commissioner Smith, Mandy Nuku indicated that she's going to reach out to you directly to talk about those donations. And then I think that that could be part of that bigger conversation of how might we want to direct them. And then Director Hoover, thank you for your comment. I would love to follow up with you offline in order to figure out how we can help support with that. And making sure that whether it's modifying the communications that are going out in your community and our team helping with that, we're willing to pivot and customize.
Thanks, Shelley. Commissioner Warren Gully.
Thanks. Sorry for another question, Shelley. I was just thinking about what about our folks that are like me services? Have they been included in these conversations? So I'm thinking Meals on Wheels and people like that, you know, I know lots of times they try to find funding to provide extra food during the holidays, since a lot of these folks don't have access to that. But I didn't know if those two worlds cross or how that work happens.
Thank you, Commissioner Warren Gully. Yesterday, when we asked the food banks and food pantries specifically about some of those, I think we just didn't have the right folks on the call to be able to respond to that. And it's probably you all or the human services directors to know what would be helpful for some of those prepared meals, and if that's something that we should be focusing on standing up, and if there is a need. So I'd love to be able to, and maybe we do need a second conversation here to now digest this information and come back, and what are some of those creative levers that we have, like the indemnification or tax benefits, things like that. And then also, is there a need for prepared meals and standing up some of those kind of emergency systems that we've done in COVID, we've done in disaster areas before in the state.
Okay. I'll try, Shelley, to reach out to our provider, Nourish Meals on Wheels, and I'll let you know when I find out what they're hearing.
Okay, great. Kelly, do you mind if I respond to Liz's question?
I was just going to ask you to. Thank you.
Great. So Commissioner Smith asked if the Hold on SNAP also applies to WIC. They are different. They are different programs run out of different federal partners. So this hold specifically is for SNAP, but and I'm not well equipped to talk about WIC because it is within a different department, but I can get answers, of course. But I know that WIC was one of the first funds that was unavailable in October, and the legislature did take action to fund WIC. I don't know for how long that funding goes, and I probably should know that just as a general state employee, but I'm sorry that I don't right now, and I can get back to you. But they are two separate programs. So. Okay, and so we'll make sure and we'll touch base with a CDPHE and then to be able to get you answers about WIC.
Thank you. Katie McDougall.
Hey, good morning, Shelley. Thank you for your time this morning. Along the same lines of the WIC question, and hopefully you receive some guidance back from our federal partners, but as you're working through that, I'm also curious about if they choose to suspend EBT at retailers, will that also expand to TANF and adult financial benefits as well? And is there a way for us to separate that so that we don't lose that important benefit to Coloradans too?
Right, and then cash as well. I think that it would depend on where the directive came from. If it came from FNS instead of ACF. So great question that I will have our legal team look into.
Great.
Yeah, thank you. Yeah.
Okay.
Shelley, I see you're reading. The question is Feeding Colorado reaching out to corporate giving donors to stress the immediate need?
I believe so. I feel pretty confident in that, given that the majority of the folks who were on the phone from the food banks and pantries were the development directors yesterday. So I think that they are pulling out all stops. And Katie, thank you for asking CDPHE about WIC. Appreciate that. Okay, I think I have a lot of good follow-up things. I'm hopping into another meeting for several hours, so it's going to be by the end of the day, hopefully, that I'll be able to get back to you, and I'll directly facilitate that through you, Kelly, or Katie, or both of you, in order to make sure we get the answers. And then maybe we can also talk about facilitating another call with you all to kind of level 2 on all of this.
That would be so wonderful. Shelley, thank you again for your time today and all this week and what we know will be your time in all the weeks to come. So thank you for the partnership and answering these questions. Would love to host another webinar discussion as some of this maybe hopefully becomes a little bit more clear. So we'll follow up with that as just kind of housekeeping for commissioners and directors on the call. We'll send out these slides and make sure that you've got that, in particular, the slide that really does kind of talk about the key messaging that your directors are going to use with clients that you can help. And I think that kind of covered our cleanup note there. And I will give one last call for any questions.
Kelly, sorry.
Sure.
Katie and Kelly. I'll send CCI the same report that I send to the county directors about zero balances. And my computer just is doing a spinning wheel, but I was trying to capture the rest of the remaining questions so I could follow up with you. But what might be helpful is if you're able to send me a quick email with these questions, that all of them that remain unanswered, and I can get our team on answering all of them.
Awesome.
And I apologize. I was trying to do that, but now blue.
You know, we will help you, and you've got the blue wheel of death, and now you're frozen. And so it's probably the sign to set everybody free this morning. Thanks again, everyone, for your time.
Thank you,
Shelley.
you're
back. Okay. Yeah, I was just going to text you and say, oh gosh, I'm sorry. What I just want you to know is thank you for your partnership. These times are really hard for our communities and our neighbors, and I appreciate your care and concern and partnership in this too. So if you'll help me with those questions, I'll make sure they get answered, and then we'll follow up on them getting another meeting.
Thank you, Shelley.
Thank you.
Thank you, everyone. Be safe this weekend, and talk to you soon. Thank you.
Thank you.